Disclaimer: the contents of Studio 151 podcast and the TU Communication Disorders Connection podcast do not represent the views and beliefs of the University of Tulsa and the Mary Kay Chapman Center.
The content covered in this podcast reflects knowledge we've obtained from the ASHA Practice Portal as well as our own personal, clinical, and educational experiences. Hello, welcome back to another episode of the TU Communication Disorders Connection podcast. This is your host, Alyssa Hall, and today I'm very happy to be joined by one of my classmates and good friends, the lovely Gillian Gallant, who is one of our first-year graduate students at the University of Tulsa. Gillian, it's good to have you in the studio today.
Thanks for having me. I'm so excited.
Today, Gillian and I are going to be talking a little bit about the SLP Big 9 area of voice, which I feel like is one that doesn't get a whole lot of coverage, so I'm excited to have this discussion. I am going to jump right in with some questions for Gillian. To start us off, we use voice frequently in and outside of the speech path community, but we don't often explain what we mean when we say that word, especially in our clinical and professional settings. Gillian, can you define the word voice for me?
Yes, so voice refers to the sound produced through the vocal tract, often discussed in the context of speech or phonation. Our perception of someone's voice comes down to a few factors: pitch, loudness, and quality of voice. Pitch is going to be how high or low your voice is, while loudness refers to how soft or loud your voice is. And quality is a mostly subjective measure, but we do have some descriptive terms to help us classify those voices.
Going along with that, what are some of those descriptive terms you might use to describe someone's voice quality?
So, depending on their diagnosis, you might describe someone's voice as strained, breathy, raspy, or rough. These descriptions give you some potential ideas about what might be going on with their vocal folds. These subjective terms are helpful because most people know what they mean, not just a speech-language pathologist. However, there are also some objective measures we might use.
Again, you set me up for another question. What are some ways an SLP might objectively assess or evaluate someone's voice?
A speech-language pathologist might take measurements such as pitch, range, loudness range, and fundamental frequency by asking a patient to make and sustain sounds and having a computer program generate values based on the sample. So you can ask a patient to sustain, ah, or count to 10 with increasing loudness to assess some of these factors. We can also look at a patient's SZ ratio, which assesses laryngeal function. Here, the patient is asked to sustain an S as long as possible, twice, and do the same with Z. The longest value of each of these are going to be recorded and made into an SZ ratio. This is going to compare their ability to phonate on voiced versus voiceless sounds. However, there are processes which affect voice. Respiration is one. We might assess breathing by counting a person's cycle of respiration per minute or observing their type of breathing. These can be clavicular, diaphragmatic, and thoracic.
Hello everybody, I have some unfortunate news. Due to some technical issues, I lost the remainder of my recording with Gillian, but I'm going to swoop on in and cover the rest of the content that we had planned for this discussion. Going off of what Gillian had left us with, some common examples of voice disorders. One of the most prevalent are vocal nodules, which are non-cancerous growths that form due to overuse. Nodules are common for people such as teachers, singers, or anyone who does a lot of shouting in their profession or their personal life. When someone has nodules, their voice can sound hoarse, breathy, and rough, and that can sound somewhat similar to when you've been to a concert the night before and you haven't yet recovered from yelling. Another disorder I'll mention is vocal fold paralysis, which causes the loss of control of muscles that control your voice. This happens when nerve impulses to your voice box, which is commonly known as the larynx, are disrupted, and this results in paralysis of the vocal cord muscles. This can lead your voice to sound really breathy, weak, or quiet. One last disorder I'll quickly mention is spasmodic dysphonia. This is a neurological condition in which your vocal folds spasm during phonation. Your voice can sound strangled, choppy, or breathy, depending on the type. Spasmodic dysphonia can be of the adductor type, in which your vocal folds spasm together, or the abductor type, in which they spasm apart. And so both of those diagnoses can lead to different voice quality. However, spasmodic dysphonia can also be mixed, so you might experience a mix of those separate symptoms and voice qualities. Let's briefly consider some other diagnoses that might affect someone's voice. There's a couple to consider. Neurological conditions like Parkinson's, ALS, MS, and strokes can cause changes in your voice. Additionally, if someone has cancer, especially head or neck cancer, when cancer involves the larynx, tongue, or vocal folds, treatments such as surgery or radiation can drastically change your voice quality. Hypothyroidism has also been seen to affect voice. Low thyroid levels can cause the vocal folds to swell, and that can make the voice sound deeper, hoarser, or generally less flexible. Finally, and interestingly, acid reflux has been known to agitate the voice box. People may have chronic hoarseness and excessively clear their throat if they're experiencing the voice effects of acid reflux. So let's think a little bit about how an SLP might treat a voice disorder. Voice therapy is one of those areas of an SLP's scope of practice that is highly individualized and tailored to the individual's needs, but there are some main approaches an SLP might take in making that intervention plan. Providing vocal hygiene education to their patients. This includes instructing patients on how to protect their voice by doing things like staying hydrated, avoiding yelling, and trying to minimize throat clearing. An SLP might refer to other professionals such as an ENT if more invasive surgical interventions are required. Another area SLPs might assist their patients is in things like providing gender-affirming voice therapy for transgender clients, or any other setting in which someone wants to modify their voice for the purpose of communication. All right, I will leave it there. As always, a big thank you to Gillian Gallant for joining me today, and I hope that you will join us in the next episode.
For further information or podcast ideas that you'd like to share with us, please reach out at 918-631-2504. We would be happy to chat with you. Remember, communication is not just about words. It's about understanding, empathy, and connection. Until next time, keep listening, keep learning, and keep communicating.